Does taking Tylenol in pregnancy really increase autism or ADHD risk? Early studies said maybe, but the best science says otherwise. Why don't we break it down? This is likely what everyone is using to link the two things. This is a review of 7 studies that suggested there may be a 19% risk of autism in exposed children. But here is something very important. Not a lot of people will talk about this. Even the authors mentioned that this study is not as strong as they believe. The data was only observational. The studies measured exposure and outcomes in very different ways, and the evidence was vulnerable to several sources of bias. And that's what the issue is. Several of these earlier studies could not separate Tylenol from things like family genetics or other health conditions, or why even Tylenol was used in the first place. This is why these newer studies used a smarter design, sibling analysis. Imagine 2 kids in the same family. That means same home, same parents, same everything. And one was exposed to Tylenol in pregnancy and one was not. And if Tylenol really caused an issue in pregnancy, you would think that there would be a difference, right? This huge Swedish study found, after looking at nearly 2.5 million kids from 1995 to 2019. And in the sibling analysis, the hazard ratio was 0.98, the confidence interval of 0.93 to 1.04. And what does that translate to? That translates to no link at all. And this is the conclusion in the end. A second most recent study in Japan looked at 217,000 kids. And at first, the numbers looked like a small increase. The hazard ratio was about 1.06. But again, they then used a sibling analysis, and this effect disappeared. In fact, estimates even dropped below 1, showing no increased risk. And then when they added things like unrecorded over-the-counter use, the associations faded even more. So bottom line, the best studies. Millions of kids, sibling analysis shows Tylenol or acetaminophen use is not associated with autism.